Today, and to all who are here at this moment of extreme challenge for our country and for the world. And we must rise to the occasion and unite to fight a common enemy, COVID-19, also known as the coronavirus. And what we're witnessing, Mr. President, is Americans from all backgrounds and all walks of life doing that around the country, coming together and uniting, not physically close, but spiritually close to one another as we work our way through this crisis. In my state of Maryland, people are doing exactly that. Our healthcare workers on the front lines, whether they be nurses, whether they be people working in clinics in the hospitals, whether they be doctors, they're all pulling together to get the job done. Elected officials from the federal, state, and local governments are working together, as are nonprofits and businesses. 3 nights ago, I held a telephone town hall meeting on COVID-19, and more than 5,000 Marylanders joined that call. They called in to share their hopes, their concerns, and their determination. Mr. President, yesterday in Maryland, we lost the second life to COVID-19, and our medical services are being stretched thin. But people are coming together to get the job done. And as we address the healthcare challenges, we must also deal with the financial and economic pain that is arising from that and spreading quickly. Most of all, Marylanders, like other Americans, told us they want clear guidance from public health officials and a united and effective response to both the healthcare crisis and the economic fallout. Since Marylanders are united and Americans are united, we too in Congress must unite to do our job. And to date, we've risen to meet the moment. The question is, what comes next? Over a few weeks ago, we did unite to pass legislation, emergency legislation, to provide $8.3 billion to provide funding to our public health systems and to direct more dollars towards developing a vaccine and therapeutics. Last week, we passed a measure to ensure that tests for the coronavirus are free, because it makes no sense to have any American discouraged from getting a test because they can't pay for it. That hurts them, that hurts the entire community. That was an important provision, as was the emergency food assistance for people in need. We have lots of students in states that have closed schools who are now home. Many of those students get one of their best meals at school during lunch, and so that emergency food assistance has been absolutely vital. In Maryland, we have about 350 schools that are now being used for families to pick up food for their kids and for others in the community. We help provide more resources to state uninsurance systems, which are being stressed more and more as we speak, and we need to do a lot more on that front. We passed emergency sick leave measures because we do not want to have anybody feeling that they've got to go to work in order to get the paycheck to pay the bills if they're feeling sick. That's bad for them, and obviously it's bad for their coworkers who would risk getting the virus. So we took an important measure there, although there as well, there were big gaps in the paid sick leave provisions, which we must close as we work on round 3 of this legislation. And so that brings me to what we're going to face now in the coming 12 to 24 hours, which is coming up with an economic package, a package that deals with the economic fallout. And I want to address what I think should be our priorities there, Mr. President. But before I do that, I do want to take a moment to talk about the healthcare situation that we're witnessing right now. Because, of course, to the extent that we can stop the spread of the virus, to the extent we stop the contagion from the virus, that is also the fastest way to trying to get our economy back on track, because what we're seeing is so many businesses going under and being threatened because of precautions people are taking, understandable precautions, to make sure that we don't spread the virus. So in that fight on the healthcare front, I want to salute and thank all those healthcare workers who are on the front lines. The nurses, the hospital and clinic staffs, the doctors who are doing heroic work and putting their lives and their health at risk to help others and save the lives of others. And we here in this chamber must do everything in our power to support them in that important work, to support them as they support others. And that begins with making sure that they have all the equipment they need to protect themselves. But Mr. President, that is not happening. That is not happening as we gather here. There are severe shortages in the supply of masks, shortages in supplies of simple but essential items like gloves and gowns. It took far too long, but the President finally invoked his authority under the Defense Production Act, which helps spur domestic production of some of these supplies. But even as we gather now, it's not clear whether that's really up and running as it should be. In fact, it's suggested from reports that we're falling short. At the same time, we know others in the world are experiencing these shortages. They're also being hit hard by the coronavirus. So here in the United States, we cannot continue to expect to get these necessary supplies from overseas when they're going to need them and keep them in their own countries. And that's why it's essential that we ramp up efforts yesterday to make sure that we have these supply chains here at home. Testing of the coronavirus. Mr. President, it's clear that the coronavirus got an 8 to 10 week head start in this country, and we were woefully unprepared, especially with respect to tests to try to identify the spread of the virus and where it was and how fast it was moving. Also unprepared on our testing infrastructure. And while we are now ramping up, we are still far behind. Still far too many bottlenecks in the system. At Johns Hopkins University in Baltimore, they're doing their own testing, but their testing has been limited by shortages in reagents. That was true a week ago. It continues to be true today. And the University of Maryland Medical System, another major research hospital system in our state, has not yet begun to do their testing because of continued shortages of reagents. That is absolutely unacceptable. We're also hearing of shortages in swabs, simple swabs, simply to take the tests. We need to ramp up the testing supply. We also need to knock down the barriers to getting tests. We need to adopt the South Korean model. Many of us have been calling for this for a long time. We see states and governors moving forward with this, but the federal government needs to take a much more active role in establishing that infrastructure. Ventilators. We have more and more sick patients, and if the trajectories continue, it's clear we will face a shortage in ventilators. We got to ramp this up much faster than we're doing right now, because otherwise we're going to have a life-saving treatment and intervention that will not be available for those who need it. Mr. President, we're witnessing shortages in hospital beds overall and shortages of beds in ICUs. We need the Army Corps of Engineers to be working and building out this necessary emergency infrastructure. And as we take these emergency measures, we also need to continue to do the urgent work of developing therapeutics and a vaccine. I visited the National Institutes of Health about 3 to 4 weeks ago. It's a national treasure. We're proud to have it located in the state of Maryland, along with the FDA. And at NIH, I met with scientists who are on the front lines of developing the vaccine, and they are working 24/7. Mr. President, I do think this moment it's appropriate to salute all the men and women who work at NIH for the good work they do, and I hope I never see another budget proposal coming down that cuts the vital medical research that is conducted there and around the country. They are working on a vaccine, and they're working on therapeutics. They're in the process of conducting clinical trials on both. As we've heard reported, they're conducting clinical trials on some off-label drugs. These are drugs that had been developed to try to address other diseases. They may not have worked against other diseases. They may work as a therapeutic. In this case of the coronavirus, they may work, but as Dr. Fauci has cautioned us, we won't know until we do the clinical trials. And nobody's hope should be unrealistically raised until the evidence is in. On the vaccine front, we've been told by the scientists, by Dr. Fauci and others at his lab, that it will probably take a minimum of 12 to 18 months to develop a vaccine, and that's much faster than the usual timetable to develop a vaccine. People are working overtime to get this done. Clinical trials have already begun on a vaccine as well. But 12 to 18 months, while fast for developing a new vaccine, is a long time given the immediate crisis that we face now. So what do we do now on the healthcare front? First, no more mixed messages. Let's let the healthcare authorities speak and provide the guidance that the American people need at this time. For far too long, the President of the United States downplayed the crisis, even calling it a hoax at one point. Mr. President, we know it's not a hoax. We know that death toll and the number of sick continues to rise, and we must pull together in a fact-based way to address it. We've got to listen to people like Dr. Fauci and others who have called for dramatic social distancing measures. One of those measures we must take is teleworking wherever we can do it. We have seen offices here in the Senate and the House rapidly move toward teleworking and make changes in their offices to facilitate teleworking. Just a few days ago, the President finally said to the country that employers should facilitate telework. A little late, but it was the right message. Unfortunately, Mr. President, there's been a lot of foot dragging in the executive branch itself when it comes to teleworking. I and a number of our colleagues have asked the President to issue an executive order on teleworking. The President has not done that yet. The head of the Office of Personnel Management resigned a few days ago, right? So this is the person who's in charge of all the federal government personnel from an operational standpoint, resigned in the middle of this crisis. We don't know why. Finally, OMB, the Office of Management and Budget, issued a directive to agencies saying maximize telework, but I represent a lot of federal employees, and I'm hearing from lots of them that their agencies apparently haven't gotten the message. The President needs to issue that executive order, and he needs to do it today. Too many federal employees are being put at risk because agencies have not taken the time to expand telework opportunities. We need to lead by example, not from behind. Many governors are leading by example, and states are doing that, as are local officials. They're directing the necessary social distancing measures. In my state of Maryland, Governor Hollen has closed schools to prevent the spread of the virus. Restaurants are closed, bars are closed, gyms are closed, many other gathering places are closed. And all those social distancing steps being taken, whether by government directive or voluntarily by our constituents heeding the calls to take these precautionary measures, all of those necessary steps have resulted in a huge and escalating economic fallout. Thousands of workers have already been furloughed or laid off around the country. Small businesses are being crushed. No customers in the door, no sales, no income. That means you can't pay your employees. It means you can't pay your bills, whether they're mortgages on your restaurant or mortgages on your home. Those bills are still due and coming. So what do we do? What do we do as we approach round 3 here in the United States Senate and House, having successfully worked on a bipartisan basis to address rounds 1 and rounds 2? First of all, Mr. President, unemployment insurance. Because of rapidly escalating layoffs around the country, claims are rising, and we need to rise to the occasion. We need a far more robust system, and certainly during this emergency period, we should provide 100% wage replacement to workers who have lost their jobs through no fault of their own as a result of this crisis. We also need to address the totally antiquated aspects of our unemployment insurance system. Now, some of that will have to wait till after the crisis, but on an emergency basis, we need to address the needs of people who are working as self-employed, individual contractors. Let's say you're an event planner. All your events got canceled. You're not currently in the unemployment system in most states, probably. But you're no longer getting any income. We need to make sure the unemployment system in this emergency addresses those workers, and then we need to work on a long-term fix. The gig economy. We all know the gig economy is a larger and larger share of our economy. A lot of those workers are not covered. If you're a worker who's in the taxi business or working for one of the other transportation agencies, you're not able to pick up folks at the airport anymore because people aren't coming to the airport, but you're not covered by most unemployment systems. So whether it's Uber or others, we need to address those workers and make sure that they have wage replacement during this terrible shutdown of our parts of our economy. So we need to really focus on that. Senator Wyden has introduced a bill, I'm proud to co-sponsor it with him, that addresses many of these issues, but we need to tackle it as part of the bill that we're dealing with right now, because these people are losing their jobs right now. Second, no foreclosures or evictions during this period of time. You lose your job, you got no money, we're working on wage replacement, but we haven't done this yet. In the meantime, the bills are coming due. Someone's demanding a mortgage payment, someone's demanding a rent payment. We need to freeze collections of these payments and defer payments until after the emergency. Now, this is easier said than done, because when we say to a landlord, you can't collect the rent, we also need to say to the bank who loaned money to the owner of the building that you've got to exercise forbearance on that loan. That's why a group of us, I organized a letter recently that went to the heads of the financial regulatory agencies, the Fed, the OCC, the FDIC, asking them to use the full extent of their powers to address this issue in a way that deals with the entire economic food chain, from the lenders at the top of the chain to the borrowers at the bottom of the chain, because they're the ones in a position to do it. I just got a letter back last night from the FDIC. I hope to hear from the others quickly, but we don't have time to wait. We should address that issue to the maximum extent in our powers in round 3 that we're working on right now. So third, small businesses and medium-sized businesses. Crushed. No customers in the door, no revenue, bills mounting, trying to make payroll. Many of them, of course, have had to already lay off some of their employees because their bills are coming due and they've got to try to figure out how to simply stay afloat. Now, a lot of people have said, well, let's give these small businesses emergency loans. Well, if you think about it, if you're a small mom and pop operation, another loan at this point when there are no customers coming in the door is simply going to saddle you with more and more debts at the end of this emergency. And so extending a loan is in some ways for these small businesses throwing them an anchor because they're never going to be able to recover. They're only going to have more and more debts to pay off at the end of the day when they're trying to restart their businesses, get people back in the door. I have a wonderful local example. Her name is Julie Verratti. She's the co-owner of a brewery and restaurant in Maryland called Denizens. It's a family business. She wrote to me a number of days ago because she's undergoing exactly these kind of stresses and pressures. She says small businesses need a bailout right now and without delay. The number one thing we need is cash retention and cash infusion. Here's some specific actions that would help make this happen. Number one, an immediate moratorium on all commercial debt payments, loans and credit cards, mortgages and rents. And if you have to choose to focus on SBA loans because small businesses are the ones that are really going to get back, that are backed by the SBA route. She also says an immediate moratorium on all evictions and foreclosures. So we are, of course, got to work on that front. I talked about that. But we also have to attack this from all angles. And that's why this small business relief is so essential, and it must take the form of grants so long as the businesses use that money for the prescribed purposes. Maintaining payroll, whatever payroll may be left, and paying their ongoing debts and obligations. Loans, as Julie says here, will not fix this for small businesses. It must be in the form of grants, again, so long as the recipient complies with the terms of that grants. And small businesses like mom and pop operations who've already had to lay off employees should not be penalized. They should still be eligible for the grants to pay their mortgages to keep themselves afloat. Mr. President, many mid-sized businesses are in this position as well. And we need to address that because they are, in many cases, laying off employees in large numbers. Just another local example, people who live in this area may be familiar with the Silver Diner. So unlike Dunkin' Donuts that works on a franchise model, the Silver Diner owns its different Silver Diners throughout the region. They have 1,800 employees. Their employees, in most cases, have had to be furloughed or laid off because no money in the door. But the Silver Diner is too big an operation to meet the strict requirements of the Small Business Administration. And so in this emergency situation, we need to provide flexibility that allows us to help some of these middle-sized businesses that are undergoing incredible stress, because we want to make sure we help their workers and help them retain as many workers as they can, but also to make sure they can pay their bills when no customers are coming in the door, because they need to pay the bills so that when this is over, they can open up operations and rehire those employees. And that's why Senators Murphy and Merkley and I introduced a proposal yesterday to address these stresses on small and medium-sized businesses, not with emergency loans that they're not going to be able to afford to repay later, but with emergency grants, so long as those grants are used for the purposes indicated. And that would put these small and mid-sized businesses in a position to rehire their employees once this economic storm passes through. There are, of course, other major industries that have been hard hit, and we should consider what kind of relief is appropriate for them, like the airlines. But, Mr. President, we have to be very careful that we don't repeat some of the things that went wrong in the past when it came to helping big businesses. Yes, we'd like to help their workers through this storm, but we need to make sure that any funds that go to the airlines, for example, are not used for more stock buybacks that simply help their stockholders and executives and CEOs. The airlines have engaged in a huge amount of stock buybacks in the last year, including after the $2 trillion tax cut that was provided. Instead of using a lot of that revenue to invest in their workers and plant equipment, a lot of it went out the door in the form of stock buybacks. And it would be unacceptable for any relief monies for that kind of purpose, or to go for any kind of bonuses. In fact, if the taxpayers are going to be making some investments to keep some of these big industries afloat, we should look at what we did in some of the earlier cases later in the game with respect to preferred stock, so that taxpayers get fully repaid, and that we also have a stake in the future success of that investment. Mr. President, one other big area that has not gotten as much attention in discussions here on Capitol Hill until the last few days has been the huge needs being faced by state and local governments. States like my state of Maryland, cities like Baltimore City, and other cities and towns in Maryland. They are on the front lines in many respects, and they're facing huge pressures, which is why we received a letter, an emergency plea from the National Governors Association just the other day. And this is a bipartisan plea from Governors Larry Hogan and Andrew Cuomo. And they point out, number one, that Medicaid is a major source of federal help that they use to provide for the medical needs of people in their states. And they're asking for an increase in FMAP. Now, we provided some increase in FMAP in one of the earlier bills we passed, but they desperately need more as the health impact of the virus continues to spread. As you can imagine, transit systems, whether paid for by states or local jurisdictions, are essentially seeing all their revenues dry up as people understandably don't get on those crowded systems. And so no revenue means that they're in a world of hurt. So we need to provide emergency help. The National League of Cities has also sent us a letter talking about similar kinds of needs. And we need to address those needs in this bill, round 3, and not do, as some are suggesting, postpone that to some future date. We don't know when that would be, because the emergency is now and the need is now. Finally, Mr. President, this healthcare crisis has exposed some huge fissures in our society and the kind of safety net that we provide. And I'm not going to go into the entire list because it's too exhaustive to go through, but I want to highlight a couple things. We had, in the first instance, the question of whether people are going to have to pay for the coronavirus tests. And we all recognize that as a public health imperative, it would be a mistake to have people have to pay for tests, because if you can't afford it and therefore don't get it, then it not only hurts you, but it hurts other people. But there's been a lot of discussion about the vaccine. And when we develop a vaccine, and we hope we will, that also needs to be available to all Americans without cost. That's something that we need to address. Now, Senator Scott from Florida and I have pointed out that a lot of the drugs that are developed by pharmaceutical companies are drugs that benefited from the research at the National Institutes of Health. And who pays for the research at the National Institutes of Health, at NIH? Well, the taxpayer, to the tune of about $40 billion a year. So it makes no sense at all for the taxpayers who made this big investment in research and development of a drug to then be price gouged by the pharmaceutical companies that take the benefits of that good work and then add a big price tag. And so our proposal would make sure that where you have that kind of public investment in research and development, you essentially have a process to make sure that there's a reasonable price. And ultimately, when it comes to a public health vaccine, as is being developed now, we need to make sure it's available to everybody and that nobody can not afford that. Second, as our schools have been shut in many states, we're seeing the results of the digital divide, just one piece of that, because there are a lot of students who don't have access to the internet. And therefore, they're not going to be able to engage in distance learning if this crisis continues and schools decide to try to expand distance learning. Why? Because they're not connected to the internet, or they don't have a computer at home. So many of us have introduced proposals on this. I've introduced a bill to close the digital homework gap. We're asking the FCC to use emergency authorities to direct funds to buy devices, simple devices that a student who's not connected to the internet could use to get some reception to be able to do their homework. We should do that right now, but then of course we've got the longer term challenge of building out that infrastructure, broadband infrastructure to deal with the digital divide. And then there are things that we should do to make sure we're better prepared. And there's a long list of those, but one of them is pretty simple. And Senator Angus King and I have sent a letter to the folks who are finalizing and putting this bill together to require that the office at the White House that had previously existed under the Obama administration, the office that was set up specifically to be an early warning system for a pandemic response like the one that we're witnessing, that be a permanent office within the White House, and that no future president would be able to dismantle that office. And we are learning now the hard way what happens when you don't have that early warning system and strategic response at the highest levels of the U.S. government. So those are some of the things we should be doing. As we gather here, America's best minds, our top scientists around the world, are looking to answer questions about the virus and help develop a vaccine. Brave healthcare workers are treating the sick and preparing for many more patients. The people who produce and deliver our food and other essentials, who keep our water, power, and internet on, they are all at work, whether in their workspaces or teleworking. First responders are on duty, and our military continues to defend the nation. Marylanders and Americans are doing their part, staying at home, social distancing, finding ways to be together while apart, and perhaps most challenging for kids, staying busy and not going completely stir-crazy. Teachers and students are embracing distance learning. Families are marking birthdays and other special occasions with e-cards and video chats. Those at the lowest risk are doing what they can to protect the most vulnerable among us. Mr. President, the fundamental decency of all these Americans is shining through. I draw strength and faith from their actions, and I know that together, if not physically, together, working together, we will succeed. We will succeed if we come together here in the House and the Senate like Americans are working together around the country. If we can do that at this moment, as we approach round 3 of our actions, then I am absolutely confident that the country will have the resources and direction it needs. Let us be as united and determined as the American people. Mr. President, I thank the body for the time and thank you for presiding.